but I'll start with Toby.
Thank you, Mike, because you did come to me last in the first panel, so I think it's... so it was my turn. And in fact, I haven't got a paper, so this isn't going to be a paper, but it will be quite a long comment. Because I wanted to put the two panels together, actually, in a way, because I think that they... Both panels talked about urban-rural migrations, actually, in different ways, and also talked about authoritarianism. So I think that it's interesting to reflect on the ways in which they work together. Because what we saw in this panel was that an enormous increase in authoritarianism in different ways, whether in the international legal framework, in your presentation, Wendy, or in specific cases regarding refugee camps, treatment of migrants, in your case, Janos, and in George, in your case, in terms of the control over the information framework and the way in which that was used to manufacture consent, which didn't really exist in your discussion. So we saw an enormous increase in authoritarianism here, which was linked to the failures of the international community. But yet in the previous panel, we had this discussion of a very authoritarian framework, which might have been successful in some ways, or seemed to be successful in the way in which COVID did or didn't spread. So it's interesting to juxtapose those two together, because they're not really compatible, so we have to reflect on why that is. And I think there are various things we could say. I mean, first of all, I think the fundamental question for me is, how do we define success? I think, Janos, in your paper, you gave an interesting response to that, is that, or you showed a way to think about it, because we saw that, if we're defining success solely through the lens of COVID, then we can define success in some ways. If we then look at all the ramifications of other health concerns, which were, as you said, much stronger for many populations in places around the world, controlling COVID isn't necessarily a success. You might control COVID and let lots of other things become far worse. And then, so how do we make those judgments? Well, I think fundamentally it comes down to the question of risk, it seems to me. And it was very well known at the outset what the risk factors were for COVID-19. It was also very well known, as we, I think, saw in a previous panel, I can't quite remember which panel it was, that the median age on the African continent, for example, was under 20, and that therefore the risk factors in Africa were low. And that therefore, and then we have to start reflecting on lots of other things which we haven't really talked about, but we really have to bring to the table now. A global pandemic. Well, yes, it was a global pandemic, but we also have to bear in mind, as I pointed out in the book, the COVID Consensus, that the WHO redefined pandemic in 2009 to mean something in a very different way. So that, in fact, as we saw with monkeypox, for example, there were talks about monkeypox being defined as a pandemic. Well, and when we look at the international health regulations and the way in which they can be and are now being changed, we have to reflect on how we define pandemics, how we look at the relationship that has to authoritarianism. And I think that these are fundamental questions. And it comes back to the question of how we define success, and whether a one singular focus is really sufficient in any health situation, because there are so many existing conditions which have to be considered as well. And that comes back to the framework which, Vandine, you discussed in your presentation around the WHO guidelines. So for the COVID Consensus, the second edition, I interviewed the lead author of the 2019 WHO report on non-pharmaceutical interventions, Ben Cowling from Hong Kong University. And Ben Cowling told me, so you put that slide up which shows the recommendations in that report, that under no circumstances should you close borders, do contact tracing, things which became the norm. And he told me that that report was based on the state-of-the-art knowledge. It was based on state-of-the-art knowledge of the restriction of pandemics. That was the scientific framework in November 2019. So we have to ask, why, therefore, we would then start reflecting on success in a completely different way just 3 or 4 months later. And I think, George, your paper is relevant to that. It's about control. That relates clearly to the control of the information framework and how that was rolled out. And, we have to consider these consequences. And when we talk about success, I am going to stop soon. I did say it was almost a paper. When we talk about success, we also have to reflect on comparisons of success and what that might mean. So, social scientists have talked for 40 years about something called the Prescott curve. I've written about this. The Prescott curve shows quite clearly that in low-income countries, when you increase GDP by a very small amount, you have a huge increase in life expectancy. So clearly, when you decrease GDP, you also have huge reduction in life expectancy. So comparisons with Tanzania, for example, which are often brought up, well, Tanzania was one of only 2 African countries in 2020 which actually saw an increase in GDP. So in fact, what we see is that, it depends how you define success. If you're defining success through COVID, Tanzania was not a success. If you're defining success through long-term life expectancies, Tanzania was a success. So, we have to reflect on all these things, and that brings me to my question to the panel, which is, when we reflect on all of this and on the definition of success, perhaps, what do you attribute the authoritarian turn to? Okay, what do you attribute the authoritarian turn to, and how might that help us to reflect on the way in which definitions of success were changed?
Thank you.
Thank you, Toby.
That's a very nice question, but I first want to compliment the whole presenters for their very nice presentations. But I will go back to Juan's presentation again. I agree with the critic that the international organizations not being having the scrutiny over lockdowns, and I think there should be more. There should be place for more critical reflections on them from the beginning onwards. I totally agree with that. But on the other hand, taking the pandemic influenza plan and assuming that it would be applicable to COVID, I don't agree with that. And because, yeah, we can have a discussion, because influenza and COVID are different diseases. So taking it and assuming that it would apply completely on the case of COVID is, they are different. So for instance, influenza, in the case, just taking it from my example, the kids. So influenza is spread at schools, but COVID is not. Well, relatively, if you look at all the spread places, schools are one of the least spreading places. So these are different viruses. These have different transmission patterns as well, and the fatality rates are different. So then the measures taken can also be naturally different. Yes, there should be more scrutiny towards the measures taken and more place for critical reflections, but taking the influenza plan and assuming that it would apply completely to COVID, I don't agree with that.
Ben Cowling said that they considered that, and they considered that coronaviruses and influenzas were effectively comparable. So that was the WHO lead author's view on that question.
Nice and succinct. Thank you, Toby. I'll come to Ree.
Yes, I just wanted to make a very brief point in relation to this question of success, which is that we do have to bear in mind that throughout the world, COVID is now an endemic disease. So any sort of success, even in the narrow terms of quote-unquote preventing or controlling COVID, has, in the long term, as it was always guaranteed to do, which is why the WHO plans look the way they did, failed. And with respect, claims like this part of this country was never affected by COVID are, I am sure, false. Everywhere in the world, people are getting COVID on a seasonal basis and will continue to do so till the end of time.
I would like to ask my question to Mr. Ogola. There was so much misinformation and disinformation and so much effort to control all this going on. And as I have presented in yesterday, 3 people could affect the public opinion by social media and national media means. Do you think, how can we find the balance? I mean, what could have been done to control misinformation, disinformation, and how can we do it in this era of very ease to affect public opinion? Because we didn't have money, we didn't have the resources, and we could have done it. We did it for the good causes, but what if the thing that we were trying to do was bad? We could still achieve it with very easy means. What can be done, in your opinion?
Yeah, great. Wonderful presentations. And I have individual questions for all of you, but I don't want to monopolize the floor here. Well, that's why I don't want to monopolize the floor. No, fascinating. And I have something to say about this topic as well. But a general question, right? All 3 of you have struggled with this idea of people's sort of acceptance of lockdown, right? Whether it's humanitarian workers, the UN system, or political elites in Africa, and the media in particular. And I'm wondering, in your research, how people have memorized that experience, right? You can envision a lot of people in the UN system, for example, now being against lockdowns and saying, oh yeah, it was a really bad idea, it ruined people's livelihoods, et cetera, et cetera. And particularly with that, I'm finding if you read these reports now, it's very curious use of language, right? And it's almost like somewhat repentant, but they can't go fully to the actual truth, right? So I'm just wondering, in your own personal conversations with your friends and colleagues, how people are thinking of the past in that way.
Thank you. So this is something I've seen in India, and I want to know whether you have seen this in all the other countries that you've also mentioned. And this is a broader question about organized dissent and people's movements. So India had some very visible and influential people's movements and activists who were critical of neoliberal reforms, as well as the state and the UN and all aid agencies and so on. But these voices are far less heard in the media now. Their funding has been crushed by the state very systematically. So foreign funding is almost impossible for them to accept. And the media is also far more corporatized. This has obvious implications for any organized resistance. When the lockdowns happened, there wasn't any. And the state became more authoritarian and militarized, but there were no organizations and activists who could mobilize the people and provide any kind of political leadership. I find it very uncharacteristic that there has been no leadership in India when we had very impressive history of such opposition and critique of the state from the 70s and 80s onwards, when GATT was replaced by the WTO and all of this, and we have seen what has happened in the last 40 years. So it was co-opted by the state and by the big development agencies, the kind of opposition that we had, people's movements, alongside liberalization and globalization. So are we seeing a culmination of the project to suppress people's dissent and movements within a democratic framework? So all that's left is for us to come to the streets and riot. Is this something that you've seen, this kind of a systematic suppression and elision of all kind of democratic recourse in other countries, or was this specifically in India?
Yeah, we'll go a bit on the success question. I mean, again, that's the pen of where you're talking about lockdown success or response success, no? I mean, something I have not mentioned, but it's in the conclusions. Many of the participants on the interviews, they mentioned that on the view, the actually lockdown was justified somehow at the beginning and has a kind of impact in some places, urban areas specifically, in places like big cities in India, big cities in Latin America where the prevalence was high. So they mentioned initially could be justified for the unknown. We didn't know anything about the virus at the beginning. The problem disease like this was very, very soon, was instrumentalized and then becomes something more political than a health instrument, a health tool to control an outbreak, and that's what is deceived. And they realize it's something that under any means should have applied to specific populations. No, I think in terms of success, I think it was successful. We have, yesterday we were talking actually about silence, no, this kind of silence, like move on, forgot about COVID, no, and I think it was successful, the response, but also lockdown and the rest of the measures. For sure, I think we would have heard more about, no, internationally more. And I have the impression that one of the reasons why is so little done in terms of retrospective analysis from WHO, for example, perhaps is for this acknowledgement that maybe was not successful as they thought. I think could be one of the reasons. Also, as a critic from many humanitarian organizations, I don't know if you remember, but for the West Africa Ebola outbreak, some organizations, they were very vocal about the impact that was having lockdowns, because lockdown, they were applied in Liberia, in Sierra Leone. I was there in Sierra Leone, in Freetown at the time. And I mean, it was really spooky to be there and to see how they implement lockdown. And it's something some organization took the decision to speak out about the way these kind of fear-mongering measures, they were impacting negatively the epidemic response. However, in COVID, it's been silenced. Even for those that are characterized by being very outspoken, they didn't mention anything. Of course, it is a question that was discussed during many of the interviews, and they attribute this to partially for the collapse on their own organizations. They were facing something that they have never faced before. I mentioned now the impact has this paralysis in organizations that are still very centralized. This was preventing them to have more reflection in, what to say or not, but also what we mentioned yesterday quite broadly, this division in scientific community, in whether position one way or another. And I think all this internal tension is what prevent them to be more outspoken about the impact could have this lockdown in the epidemic.
Thank you.
Yeah, I think I'll speak sort of in the context of Kenya. I think Kenya's gone through a lot of sort of reflection. I think many agreed that the response was sort of an unmitigated disaster. I did some work on Kenya's sort of public health communication strategies, and one of the issues that emerged was sort of the lack of sort of stakeholder input in the development of those strategies. So it was sort of done solely by the state, when, as I mentioned previously, within the health sector, sort of in the country, there are sort of multiple actors, and therefore they expected some form of involvement, in the structuring of communication strategies. But, the state, went on it alone, and precisely because of that, things never worked out the way they expected it would. I think the state has also sort of acknowledged that they should have done things differently. Whether anything will change, I'm not too sure. On the question on misinformation and disinformation practices, it's a difficult one. It's a very difficult one, largely because within the context of a number of African countries, the state is also, an actor in misinformation. It deliberately does so. And a couple of years ago, I did some work on sort of how the social media sort of expanded to the public sphere, created sort of these important pockets of indiscipline, that allowed the public to sort of avoid sort of the gatekeeping processes that the state had erected rather, in disallowing, technically sort of disallowing them to engage in various forms of public sort of conversations. Over time, that has actually changed because the state has now become a very powerful actor within that space. It has the resources. It has the capacity to influence, for example, what's trending online. If you go on Twitter, they employ people that work the algorithms that, and unfortunately, the traditional print media also now thinks of social media as a journalistic beat. So you go to any newsroom, there's always sort of a Twitter feed, and what is trending, now we need to cover that story. But it does not trend sort of organically. It's manipulated by, bots, for example, and then other sort of interest groups. My fear is that the criminalization, of false news cannot on its own stop disinformation and misinformation sort of practices. I think there are very many sort of interest groups within that space. People are incentivized variously to engage in those practices, that if you simply sort of criminalize it, you're not really tackling the problem. How we stop it, I really don't know. I really don't know, but it might be that somebody else, has sort of the answers. But it's something that I'm still sort of struggling to get my head around. But what I know is that within that sort of particular space, although misinformation, disinformation was criminalized sort of in Kenya, it didn't stop the spread of fake news at all. It actually spurred it. So, for example, you had the state coming up with very important sort of hashtags for public information, and you'd have somebody turn it on its head, or use that very same hashtag to actually spread misinformation sort of practices. So it didn't quite work. I still don't know how it can be stopped. But I strongly feel that simply criminalizing disinformation practice is not going to stop it at all. Yeah, but it's something that I would very much invite conversation on. If you have any good ideas that we might explore, by all means, do share.
Thank you. Judge, thank you. Vandine, you have
Yes.
the floor.
So yes, so I have a few questions, but I would like to start by touching the point on the criminalization of dis and misinformation. So I'm a stay-at-home mother, and I homeschool my children and take care of the farm. But in my spare time, I also advise on international law to a few groups. And recently I've been asked to help, for free, pro bono, a group which is called the World Coalition of Independent Thinkers. They would like to raise a campaign to raise awareness on the dangers of Article 29 of the Universal Declaration of Human Rights, which is not binding, but is considered a moral backbone of the UN existence. This article allows, as you know, the Universal Declaration of Human Rights lists a long list of human rights that we all have, etc. And then Article 29 is about, yes, but all these rights and freedoms have to be adapted in the context of states, etc. So that's the summary. In Article 18 of the Declaration is about the rights of the rights and the freedom of expression and opinion. So the right to opinion is absolute, and there is no possible derogations to that. However, the Human Rights Committee, who is the Secretariat of the International Covenant of the Political and Civil Rights, has made some interpretation that the right to expression can be restricted in some circumstances. I'm sorry, it may be a bit confusing, but yes, so the right to opinion is absolute, and the right to expression can be limited. So we have seen a trend that right now the right to expression has been attacked, and many countries start to criminalize mis and disinformation. So I was approached to help this campaign, and I still don't have a clear answer. It's actually very complicated in legal terms, but we have a few plans. Like if you the question, the issue here is, if we limit the right of expression, we automatically limit the right to opinion, which is absolute. So if the states say non-state sources are spreading disinformation, then they limit the right to opinion of us. And of course, there's also the limit, they will limit the right to debate for intellectual debates, whatever. So this is the direction I aim to use. I don't know if we will be successful. I mean, I think that it's there's very limited chance. However, this is something that I advise them to do. And we can discuss about that later. So the question that Tom raised, I don't know if Mike, we could put up the slide that in my presentation of the WHO guideline. So
Yes, Vandine, give me
yeah.
30 seconds
Yes.
to find.
So some years ago, a long time ago, I made a mistake of meeting someone who was working at the WHO, who is a scientist and who coordinated the responses, one of the coordinators of the responses of WHO when SARS-CoV-1 happened. And that mistake led to another mistake that I resigned from the UN to follow him. So he was also one of the authors of the guideline on the pandemic and non-pharmaceutical responses in the cases of pandemic and influenza pandemic. So, well, my husband says that he also contributed to that guideline, and it applies to COVID. COVID, the name of the virus is SARS-CoV-2. So the guidelines name non-pharmaceutical public health measures for mitigating the risk and impact of epidemic and pandemic influenza.
But this includes COVID, you're saying?
Yes. So these guidelines. This guideline, as Kobe mentioned, was like the state of the art of how to manage epidemics, outbreaks, and pandemics, because there are different levels of epidemics and pandemics. So, so these guidelines should have applied the International Health Regulations 2005 also apply when it comes to public health events of international concern, which is just another name of pandemic, and the WHO define pandemics at 6 level. So these guidelines should have applied. That's what I been explained and told. I'm curious as to if you know. I would like to read or understand more why this guideline. This guideline is on internet. It's a little bit difficult to find, but it's written in a standard, easy to understand. Its policy. It's very clear. There was no lockdown. At no point border closure were recommended, and also each time when there was a measure, the guideline also discuss ethical, human rights, and economic concerns, and stated clearly that those who take decisions should consider that, because according to the international health regulations, when there was a pandemic, well, called international public events of public health events of international concern, the WHO doesn't have power to mandate measures and recommendations. They can only they can make recommendations called standing and temporary recommendations, but these recommendations are not binding, and each country is sovereign in taking decisions and assessing the risk. So legally speaking, the WHO could not mandate lockdown, or so it was the country. But now we're going toward a very interesting phase where the WHO is discussing proposals to prepare a pandemic treaty, plus the revision of the International Health Regulations 2005, and the changes are for the WHO recommendations will be binding. So it means that someone who stays in Geneva or even WHO regional office, here is Copenhagen, right, can say, oh, the UK, you need to lock down because there is something, you need to quarantine people. So that is the scenario if the WHO proposals on pandemic will be adopted. It's on the calendar, so it will be discussed in about a year, May 2024.
This slide,
Yes.
much of the things that come under extraordinary would qualify for lockdown, though you don't have across the board stay at home. They are not thing anyway, and I am also surprised that not recommended in any circumstances includes entry screening. I can understand exit, but in some sense entry screening is one of the few things that do survive, especially in isolated situations, and any place is isolated at a given level. So I see this, but obviously there's a whole lot to be done even on this, because finally, what have we learned about this now? You know, for face masks for symptomatic individuals, it's obviously not about preventing asymptomatic individuals from getting the infection. That's the recommendation. That I can see the problem, but I can understand that. And where does the aerosol, airborne and droplet conform to this particular issue? So there's a number of issues in putting it as a pandemic rather than as a respiratory virus or a different viruses. We are assuming certain things that may not actually fulfill. So I don't know whether these recommendations will need to be looked at again.
So as I say, on the second column, the pandemic, you know, you have pandemic and epidemic, and pandemics as defined by the WHO have 6 stages, so you know, early and so on, and this is written by the WHO. So
the acceptance of lockdown, I mean, yeah, we have not answered that. I mean, the study I did, of course, it covered different locations, so it varies hugely depending where you are. But for example, yeah, we have the Mexican case where it was never officially imposed, no, and most of the population took the decision to actually self-confine at home, no, and this actually was something repeated in places where a population felt like the government was not taking care of them. Even, for example, in Argentina, and Madalena can say obviously more, and I don't know if she will agree with me, but in the interviews they were mentioned that, for example, in Argentina, once the restrictions they were lifted, many people, particularly elderly, they describe as chronic lockdown, because they felt like the government, they would not support them. So for them, I mean, they imposed so much fear on the population that they were really frightened to leave, and even nearly 2 years later, many of them, they still locked down at home because also the vaccination starts so late, many different reasons. Then you have the situation, for example, in Senegal, Kenya, that was quite interesting because asking about same locations, I remember one of the participants say, oh, no, but here was no lockdown. I mean, here, yes, you have curfews at night time, but yeah, it was life more or less as usual, affect more in the rural areas because services disruption, public transport, school closures, so of course have an economic impact, but we didn't have a lockdown such as. Then about the same location, other participants, oh, it was horrible, it was so strict, oh, it was so long-lasting, was bad. So it was obviously a huge level of, was very subjective. But then one of the very interesting things, specifically in Senegal and also in Kenya, was the views of many population. That for them, they view COVID as something, and was mentioned by many of the other presenters, that they saw COVID was nothing to do with them. They see like a European disease. So somehow they suffer so much, particularly in the economic aspect, that they have what they call like a reaction when the vaccination arrived. There was a total rejection of anything. It's like, why if Europe gets cold, I'm being forced to get vaccinated? Why have to do that? Because Europe get a cold. So yeah, I think create these kind of tensions that was punctual as they described, but was it was mentioned towards different contexts. Yeah, I mean, that was.
Thanks. Can we have
Carlos, is it okay to go to the online one? We'll do the online, and if it's okay with everyone, we'll then finish up. This is again from Andrew, and I'll read this directly. This is great presentations, everyone. Very thought provoking. A question for Janos and Van Din. Lockdowns created a classic humanitarian situation. In brackets, food insecurity, increased poverty, etc. However, it was generally managed as a public health crisis, and humanitarian agencies did not or were not allowed to follow their mandates in many cases. Had they been involved, there might have been a more balanced approach. How can we ensure that public health professions and critical agencies, in brackets the WHO, recognise that public health-based restrictions can create a massive crisis and that they need a much more collaborative approach to pandemic management in future? And that was to Van Din and Janos.
Okay. Yeah. Yes. So yeah, great question. Thank you, Andrew. I don't really have an answer. So, I think that what has happened in the last 3 years make me strongly, lean on, we have to take back our rights, including the rights to expression and opinion. That is very important because we also, those who speak up, should not be censored and ignored, like it has been the case in the last 2 years. But I think it's very important to give the a much larger sovereignty to states, and equally, states have to recognize the sovereignty of individuals. These mandates are stupid. These mandates are against human rights, point. And we are adults. We should understand the risk. Everyone has to assess the risk and so on. We don't need to be told what to do, to put a mask on or tomorrow take something, whatever. So my 2 points, yes, sovereignty of individuals, human rights, and sovereignty of states. Because I'm very, so I was a lawyer in the UN, and if I have to apologize for that experience, I would, but I think that in the past, I was strongly, with sort of global coordination of things, but the COVID situation made me realize that we need to give back the sovereignty and the place, the full control to states. The UN should really limit its intervention, or the countries should stop intervening in other countries' business. Like that, we respect the vote of people, and I rather prefer, of course I don't want another lockdown ever again, but I rather prefer that when something happens, the people we elected fairly would say something about our life or decide this and that, and we would have the power to sanction that. I totally would disagree with tomorrow the lockdown, like in the current WHO proposal, tomorrow the lockdown or the quarantine or whatever can be imposed by someone in Copenhagen or in Bangkok or in Geneva who has nothing to do with my life, and I never elected them. So that's, I hope I answered that, and I would like to answer quickly the question on how we feel. So when it happened, I felt, so I already left the UN, but I still have many friends, and I felt very lonely, very misunderstood in the first year. Well, I lived in a place where I had the chance to defy orders and didn't have any consequences. I understand that was not the case in many places of Europe. But I have former colleagues who told me, but you are a lawyer. You have to be a good citizen. You have to respect the orders. I said, well, I also have the moral obligation to disobey when I think the order is unjust and inhuman. So that was mostly the discussion, and of course it led to a dead end. And then in the second year, I convinced a few more people, well, very few, to my side.
On regards to the food insecurity, it was interesting because that was broadly discussed with the participants, and the essence that it has become now so diluted with other international issues that it's very difficult to find many of these indirect impact. Now they will be very difficult to show the true impact, what is related to COVID, what is related to lockdown, or what is related to something else. Also because some of the repercussions that have in the health in populations, such as vaccines, they were querying whether now will be the time. I think what is important is to reinforce surveillance in all these places. All the countries where they have this huge disruption. We have to keep in mind, mass vaccination campaign in many African countries was actually disrupted because recommendations from WHO. they were considered a risky activity because imply gathering of people. Also was worsened because lack of resources, but the bottom line was suspended because was considered a gathering. So that was the reason behind. And yes, I think now, from now on, we will see the impact on children. No? I mean, many countries they stay 8 to 9 months without receiving any preventive vaccine. So yeah, I think it's important to follow and to see whether that has some impact on the health. But in regards to food insecurity, the field will be more tricky. The same that in other health issues like increase of unwanted pregnancies or sexual violence, there are things that quite often are so badly reported that will be quite tricky to find the true dimension of how, what is related to the lockdown impact. So yeah, I think we have to somehow reinforce and to be able to address in not only humanitarian organizations, I think all health systems to try to monitorize to see if it's changes on this in these regards. Yeah.
I was glad Toby brought us back to the sort of overarching set of questions around success and risk, because I've had a few thoughts sort of bubbling away, and I think that framework sort of clarifies what I'm trying to get at, which is, given we're talking about low and middle income countries, I wonder how much we need to take into account that these are places where the risks appear to be higher than they are in other contexts. These are governments, these are societies that feel they have inherent vulnerabilities, and so their perception of risk is sometimes much greater than it is in other parts of the world. And so we may have concerns about the way that lockdowns were implemented in the places we're talking about, but there was a sense at the outset of COVID in a place like Rwanda that the risk was monstrous. I mean, I'm worried about how the lockdown in Rwanda played out, and it had many, many negative repercussions, but the risk calculus at the outset, to a certain extent, I think made sense. This was a society that was looking at the disasters in places like the UK, the US, and even closer to home, South Africa, and saying, if that comes here, we're finished. We're going to have a massive death toll, our economies are going to collapse, and also no one's coming to help us here. This is an era of vaccine apartheid. The global north is hoarding the vaccine, we're not getting it. I mean, in the Rwandan case, the Danish government came to the Rwandan government and said, we'd really like you to take some of our migrants. They were trying to do a migration deal with Rwanda like the UK is at the moment. What the Danish government dangled in front of the Rwandan government was the vaccine. And Rwanda said, we won't have that. So there was a real suspicion about international help. And also these were, in the African context, societies where many people were dealing with compromised immune systems, massive prevalence of HIV. So I think we've got to build into this discussion of risk a realism about the calculations that governments were making. Yes, the measures played out in authoritarian ways, but I don't think that all of the motivations were authoritarian. I think there was a very realistic calculation of extreme risk, and maybe that should make us a little more sympathetic to some of the measures that were implemented. Thanks.
You're chairing, you tell me where to go, because I'm scared now. I'm going to get beaten up here. Carlos, who would you like me to go to?
I would like to say something towards Van Dien. I have deep respect for what you have said now in this latter part, when you were mentioning the remark of a person towards you, as you are a lawyer, you should be a morally responsible and good example to society. And I've seen this argument very often, being particularly also very interested in the law. And when people had this response, I gave a very strong example of what can be the danger of just following the order, because apparently it's the law. So my example that I gave is the kind of example that shocks people immediately and makes them think. So taking shocking examples from history helps. For instance, my remark was, if you were living in apartheid South Africa and you were a lawyer, were you still defending racial segregation only because it was the law? And I think the same applies in these kinds of circumstances where the law seems righteous because we went ahead in time, apparently there's progress and things, there's more scientific debate, but unfortunately there can be certain repetitions throughout history as well, where certain things are not seen. And I really appreciated also your comment on your slides where you said that participation of lockdowns is criminal. And I found that bold and important. I wonder if you maybe would like to disclose further. You said that you felt a bit lonely from your experiences after leaving the UN. If now, a few years later, if you have seen a bit more of a shift in your colleagues and the approach in being also a bit more bold and speaking out that certain lockdown policies have really gone too far and what is the problem and why participation can be understood as criminal. Thank you.
I was in Liberia at the beginning of the Ebola outbreak, and it was a mess. I mean, there was no really good advice coming from almost anybody. I mean, so I just wonder, is it time to really take a look at the WHO and how it's functioning, and who it functions with, and is there enough representation of professionals from different countries, et cetera? Because and the other thing too is this COVID thing. It's, in Nicaragua, they're preparing for the next one because I think with the whole question of climate change and stuff, this is going to be a big part of the future. Hopefully not, but we have to prepare for it. So I don't think we have the really time to lose to not prepare for these things.
I will be very brief, and Toby did invite us to make comments if we haven't said anything, and I have been very quiet thus far. But Phil, I felt a bit provoked by what you said, because I think, the perspective I have from Cape Verde, but even colleagues that were in the continent, is that it was yet another thing that was being imposed from the concerns of the global north and the concerns of Europe. You have more than 70% of the African population being young. So saying that we were concerned about COVID is a bit of I feel like it's a bit of a stretch. And I think if you are an European and you are in Africa, then sometimes it's a bit about thinking, when you think that they are concerned about the questions that are happening in the global north, it's about thinking, why are they concerned and what are the voices that are coming to them? But from the perspective of COVID itself, and say that people were very worried about the health. And it's again about generalizing Africa, because maybe in Rwanda that was the case, and it depends on the information that was circulating there. But going back to the rural areas, as people were saying, people are concerned about whether they can eat tomorrow. And this abstract thing that comes from somewhere, and nobody even knew about it at that stage. It's something that is affecting old people in Europe, and saying that the vast majority of people in Africa who are worried about what the day is going to look like in terms of subsistence, that this abstract COVID was the main concern, I think that would be an overestimation. I would just say that from the perspective.
Just to pick up this point, there was systematic misinformation from the medical profession about risk during COVID, okay? And this gets to my point, which is about misinformation, okay? Let's not be bamboozled by this conversation. Truth is difficult. Let's not sanitize truth, right? This misinformation or truth. That's not the way information and knowledge and wisdom works, okay? And I'd just like to point out this a work of a scholar from Oxford, Sasha Altay, okay? And George, you should write down that name. He wrote 3 recent articles on misinformation, one misinformation on misinformation. He makes the argument that we're focused on this idea that people read something on Twitter and then they're misinformed. That's not how most of us make life choices. It's a very small piece of our information, and knowledge bubble. Also, only 2% of web traffic actually goes to untrustworthy news sources. And when we talk about misinformation, it's always from the eye of the observer. So yeah, you're gullible because you trust, this news source, but actually I know the information that's real, right? And so there's a complete sort of subjective aspect to this. And I would say, like lockdown, there's a huge risk with allowing technology companies and the government, the state, to determine what is information and misinformation. Historically, we know where this goes, and it's not pretty. So, thank you.
Yeah, just one remark, because I think that's may tie a few of the points I've been catching from one and the other now. I don't attempt to defend WHO, mainly because the camera is filming me as well, hello. But also because, we have to keep in mind that perhaps part of the problem is how the different interpretation of what imply lockdown. One thing is recommend a measure, and different things, how different subjects, individuals, governments, institutions has interpreted them, no? I think someone was mentioning, that it was you yesterday, they were mentioning that there is a certain definition in what implies lockdown, and it's a fact. When I was in the research, actually it was not a clearly definition of what it is or not. WHO doesn't have one. They refer to often called lockdown. Royal Academic of Language in Spain, they have one definition. You look at the Collins Dictionary, have another one that includes movement restrictions, which is why in my presentation I was trying to be careful to mention lockdown and other movement restrictions, so they become all in the same pot. So it's a bit difficult to define what we mean when we talk about lockdowns, but yeah, the reality is maybe that will be one of the points. What constitutes, if it's the mandatory aspect to it, if it's implied like affecting everyone in the population regardless of what, if implied only when you are locked inside the house and you cannot leave or decide what to eat when, it's so many nuances there that I think we have to probably start with this, no? And mainly as well because one of my fears is whether lockdowns or these restrictions, they will become the new norm for future epidemics, and that's something that is a huge concern, personal for me. So.
Mike, before we go...
Okay, I was just pondering over, we have tried to look at the recommendations from WHO and the perception around that, even other than COVID. How do we take the recommendations? From our context, it seems to be low, even within people, the intellectuals, the people in government. When the recommendations come, the rigor around interrogating and using it is really not there. And that's the perception. And of course, when you're in the WHO side, we always told, this is a recommendation for countries to do this and do this and do that. But the countries don't follow that step. So they take it as law, copy and paste. The recommendations actually are supposed to be very well interrogated and see the contextualization for the operationalization. But again, we still see it on the flip side, that it gets imposed in a way. Somehow, there's a strong right hand telling and goading nations to do this and to do that. We've seen that. So, but basically, it's for lessons learned on how the perception of those recommendations will have to be applied. We didn't see much of this. Of course, it's still debatable how much did the data in some places influence the decision that was saying. How much did the epidemiology of risk for COVID in Africa, which was well known, how much did that determine the measures, the various pharmaceutical and non-pharmaceutical measures that were implemented in Africa, because the epidemiology was very clear, and then of course the people's needs were clear too. If you want to pose the benefits of interventions into risk, where you should put attention to. So I should just speak to that. Yes, recommendation, others take it as law, and sometimes in taking it as law, they do more, they express it more. They bring all manner of measure to see that they are more appealing in what they do. Thank you.
Thank you, and thank you everybody. I think it's been a fantastic discussion. I'd like to thank everybody actually.
You have 2 minutes.
It will be... It's my paper, Carlos. I don't have one. But no, I just want to say I think it's been a very good discussion, and it's brought together a lot of really important themes, and I'd like to thank everybody. And I think that the question of risk, I think is really important. And yes, the perceptions of risk of immunocompromised HIV patients in Africa is very important. And George and I were discussing this last night, because in the Tanzanian case it was very interesting, because one of the reasons that George, you were discussing, Magufuli did not want to impose these restrictions, was precisely because by doing so, HIV patients would not be able to access their treatment in hospitals. So these kind of risks need to be factored in and understood in a very broad way. I tend to agree with Aleida. I think that, in fact, our brother from Mozambique, Pedrito, will know very well, Elicio Macamo, your colleague in Basel, or your compatriot in Basel, has written fantastic work on the sociology of risk in Africa, suggesting that Africans have very sophisticated understandings of risk because of the more risky environments in which they tend to live. And he wrote a very interesting article right at the outbreak of the pandemic in March 2020 about how, therefore, this meant that these measures were not applicable to Africa because of the different perspective on risk, because of the understanding of the different risks which people face, and that COVID, at the end of the day, was not a major risk compared to the many risks that people face in daily life. So, I think we do have to take that all into account and also reflect on one of the themes that's come over the first 2 days, which is really that at the end of the day, communities understand their healthcare best. That is community-based healthcare. If somebody in Bihar or somebody in Delhi really thinks that the best thing for them to do is to shut themselves in and not go out and not do their daily works, then they will know that best. And if they don't, then I think one of the things we've learned is we really have to go back to community-based healthcare and their understanding of risks.
So I don't think you have to respond. But if you wish so, you can do it.
So I respond very briefly to Madalena, and we can discuss further if you like. So I didn't see a real change in mentality in many of UN colleagues or even at the WHO. The publications and the directions of the UN in the most recent publications don't indicate that. So now the UN is organized like an army here. It's very hierarchical. So you have the chief and etc. and you're supposed to follow the order. Otherwise, at midterm review and annual review, you'll be marked. So it could, will be the case. It's sad, but it's the reality. And I also would like to point out that people who joined the UN, like when I started, I signed a declaration on integrity. So this is the obligation for all public, international public servants. Just so that I think that public servants or international public servants, of course, are expected to follow orders in the organization, but in case they don't feel comfortable with that, I think ethics and integrity should lead us in our decisions.
Yes.
Yeah. I think I'd sort of just like to reiterate what sort of Wellington said about this sort of lack of contextualization of some of the sort of WHO recommendations. I think most African governments failed sort of in doing that. And for somebody who's worked in the media, I think we saw it as well. The failure to interrogate some of those sort of stock phrases, flattening the curve and all that meant very little, to local sort of context. I did write a piece on that, and I was thoroughly sort of abused, by lots of journalists sort of based in Kenya. But with the WHO recommendations, I'd refer to sort of what Toby has mentioned, which I found very interesting, was that in Kenya they actually, when they realized that the quarantines weren't working, they introduced a community-based care, and I think that was a very useful sort of local sort of intervention that worked worked very well. On the question on misinformation, thanks for I'll look for that piece of work. But I think there's also sort of been sort of this blanket understanding of misinformation, that the way it's understood within the context, say, of Europe is the same way in which it is understood sort of in Africa, where, for example, you have governments criminalizing rumors. So rumor is a very powerful way in which sort of the state is actually confronted by the public. So misinformation is also a strategy that has actually been turned on its head. So those who actually read false news, perhaps on COVID, do not necessarily believe, the news that they actually read. It is a very coded. They actually have very coded ways of sort of confronting sort of state narratives through false information. So it may apparently sort of appear as though it is misinformation, when in fact it's very deliberate. It's sort of just a coded way of actually engaging, with the state in an otherwise environment in which, perhaps, open public sort of engagement with the state is restricted sort of severely. So it is a very interesting sort of area that equally needs to be contextualized, and sort of those local nuances unravel or surfaced, for one to be able to engage with it, a lot more critically.
Thank you. John?
I have nothing else to add.
So, Mike, may I close the session?
You certainly may. That was a sparring session, I think.
So thank you very much for your contributions. I think we had a very nice session, very open, very friendly, and I think with that we deserve.
We do deserve lunch. Thank you, everyone.
Thank you.